Christopher Burbaugh, Omaha World Herald. What is the intent of the executive order? Is it talking about the executive order I issued last night? Or was it 2 nights ago now? It's starting to blur a little bit. With regard to allow health departments to give 911 departments addresses to where people are were known to be tested COVID positive. Was this so 911 dispatchers can alert first responders before they are sent to those addresses? Actually, when I did that executive order, it was specifically about making sure that we could get information into our Nebraska Health Information System, or NEHI. So that statute was what I had to waive to be able to make sure we could get that information in, so we could pull together all the data from across the state with regard to hospital facilities and ventilators and patients and how many are in them and labs and all that sort of stuff, to make sure we had one unified look at the entire state so that we could do a good job of managing that and those, where we're deploying resources and where we have issues with hospital facilities and so forth. Now, in that statute was also the statute that prevented public health departments from giving information to law enforcement. So that statute is waived. I would urge that if law enforcement and public health department wants to get together, that's a local issue to decide how that information, if it will be decided, if that information is going to be distributed, how it will be distributed. That's really up to the local public health department to work with law enforcement, bless you, Andrew, to be able to get done. So that's really a local issue to manage. I do want to emphasize, though, that even if law enforcement has information on, say, a house where somebody was tested positive, that is no guarantee that the next house that doesn't have that designation doesn't have coronavirus, right? So law enforcement really needs to treat every place they go as potentially having somebody with coronavirus, because, again, the virus spreads quickly. You never know who may be exposed. So I think any person they come in contact with, they want to treat like they potentially have the coronavirus.